As Israel's war on Hamas stretches on, Palestinian civilians continue to pay the heaviest price, with starvation reaching crisis levels. Today, a UN special rapporteur accused Israel of not only denying and restricting the flow of aid, but also destroying the food system in Gaza as part of a, quote, starvation campaign. Israel denies restricting aid, but a senior official with medical aid for Palestinians says the shortages are so acute that some parents are substituting on a mug of coffee a day, rationing what scraps of food they can find basically among their children. Now, the Gaza Health Ministry says at least 20 people have died from starvation so far, and the youngest was just 1 day old. And for some perspective on the ground in Gaza, we're joined by a UN official, an official with the UN Office for the Coordination of Humanitarian Affairs. Georgios Bpetropoulos is head of sub-office in Gaza, and he is in Rafah for us this evening. Georgios, really appreciate you taking the time to be with us tonight. We heard in the last, 10 minutes or so, that President Biden is expected to announce in his State of the Union address a bit later the establishment of a port in Gaza. We've been told that the port is going to include a temporary pier that will provide the capacity for hundreds of additional truckloads of assistance. What do you make of that news?
I think, first of all, thanks for having me. I think it's good news that there is innovative thinking around getting more aid into Gaza. We have profound difficulties in getting aid there. We are discussing any kind of crossing, any kind of checkpoints from the south parts of Gaza. We are seeing airdrops almost daily, and of course, any kind of maritime corridor would be good. But I think we have to be clear that roads are going to be the only solution for the amount and acuteness of hunger that we now have, especially in North Gaza.
And on that point, Georgios, I mean, how much aid or access critically has your team had to Gaza? How much food have you been able to help distribute? Give us a sense of in terms of population size here.
I think it's a very good question. There's 2.2 million people in Gaza, and only 200,000 to 300,000 of them are inside North Gaza. The rest of the people in Gaza have access to food. We have enough food to feed people in Gaza outside Gaza. Inside Gaza, at any one time, you'll find we have 1 to 3 days of food in our stores. The moment we get it, we distribute it. So there is access to food. The issue is how much of it is available to a population, for example, in the south that is facing a possible operation in Rafah. How much of it is nutritious food, how much of it is fresh food, and how much of it is going through checkpoints and crossings into North Gaza, where, as you said before, rightly so, we are seeing now deaths from absolutely preventable malnutrition.
And you say, I mean, it's clearly not for a lack of trying. You say on X, I'm just going to read what you've written on X. Impediment of access comes in many ways. Our missions that are not denied to depart, but too often en route, there is simply no wish to assist or support the movement of aid or aid workers. Delays, wasted time and return missions. A sad state of affairs for Gaza. Hashtag access denied. Are you saying there, Georgios, that Israeli authorities are purposefully here slowing down the process of aid? And if so, what reasons are you being given?
What I think is important to say here is that a facilitated humanitarian mission is one that reaches its objective. That could be a hospital to deliver medicine. It could be a distribution site within essentially North Gaza. Let's start there, where we have to take food from the south part through a long Gaza Strip, through battle sites, broken roads, inefficient checkpoints, and sometimes actual places where we're working very close to where fighting is taking place to reach distribution points. Now, if we are not enabled and facilitated, I think in a way that shows that there's meaningful wish to cooperate with the humanitarian system, and according to humanitarian law, then I think we have to say that we're reaching a point where we have to find some other solutions to feed people, especially in North Gaza. And when I am asked whether airdrops are those solutions, for example, I can only say again, sure, let's find more solutions. But again, the number of people and the type of food that they now need, and medicine for the malnutrition, and medical equipment to start, feeding centers for malnourished children, that can only come in the volume it needs by road. Yeah. And that means opening crossings into North Gaza.
And of course, look, the impact of this, as our viewers would have seen here, in this week from our reporting from our team, is absolutely huge. We have new data that I want to share with our viewers that shows that all of Gaza's population is now unable to meet their food needs. This is from the UN at levels seen there on your screen, levels ranging from crisis to catastrophe. I mean, already this week, George, as we have reported that people are dying as a result of malnutrition, dehydration. Talk to the urgency of this aid and what you have seen, your experience on the ground.
2 months ago, a month and a half ago, we had no deaths from malnutrition. We had some hospitals that were, or more hospitals that were functioning. Now we have deaths from malnutrition. We now also have no access to clean water in North Gaza. We have non-dependable system to get into North Gaza. And let's be very clear, from the 24th of February to the 3rd of March, we tracked less than 1,000 trucks entering the Gaza Strip, where we're calling for 500 trucks. Those trucks would have brought the amount, the quantity, and the quality of food that the more than 2 million people need, not only to remain alive, but to be healthy enough not to be malnourished. Malnutrition is a horrible way and a horrible illness. You can't see it on the street. The people that are dying with malnutrition are at home. They're weak. They're the most vulnerable. They're children, and it's a very difficult thing to detect. And it's especially difficult to detect when you essentially have a failed, a destroyed health system.